I wanted to become a physician ever since I was in high school. I was a student locally at St. Christine's School in Youngstown and Cardinal Mooney High School in Youngstown. I went on to combined program through Northeast Ohio Medical University, through Youngstown State University. And when I was in high school at Cardinal Mooney, I realized that I wanted to be a physician. I realized that I enjoyed interacting with people, helping people, and I felt like this was a nice combination of community service, community need, and using my my knowledge of science and math and being able to work with patients. I think for me to be successful, I've really taken the philosophy that we never say something like, "Well, that's not my job." We hear that a lot in businesses or in families or in communities. That's not my job. Well, really, you do what you have to do to get the job done. And so, I've done that in college and medical school and in residency when I worked at the hospital in Akron, and then now in my career at Mercy Health in Youngstown. Both in clinical and in my leadership roles. And I try to make that a philosophy as I teach young doctors, medical students, my children, that's something we don't say. You do what you have to do. We come up with better processes, and you just get the job done. So I try to make that one of my philosophies that I carry forward. One of my areas of my job that is kind of most important is bringing new physicians to our community. And we hire a lot of physicians through Mercy Health in Youngstown. I also work in Mercy Health in Lorain. In between our two areas, our 5 hospitals, we hire a lot of physicians. One of the times we were looking to grow, there was a physician that came to town that said, "I want to join your team." And we didn't think we had enough volume. I didn't think we had enough volume of that type of problem that this physician treated. And we said, we don't think we can take you in. And so he went to a different city in Pittsburgh, an hour away, but not in Youngstown. And fortunately, he came back and he said, "I really think you need me because I treat this type of illness." And it was a type of cancer that we do have a lot of. And so, we looked at numbers again and we said, I think he's right. And we hired this doc, and he's one of our most successful and busy surgeons that we have. So my takeaway is, as we hire over 100 doctors every year, first of all, we're bound to make a mistake, either hiring the wrong person or not hiring the right person. So I've come to accept that, but that's not an excuse. That's just the reality when we're looking at 100 people a year. However, I also know that when you make a decision, come back and revisit it. We were lucky enough that this doctor called me again and said, "Please look at me again." And, look at the data, talk to other people in your field, talk to other references, and to make a more informed decision the second time around if you might not have got it right the first time. During early 2020 was the beginning of the COVID-19 pandemic, and we had to make some really hard decisions when it came to closing our medical practices, closing our surgery department, and also figuring out how to staff potentially a new hospital at the Kravec Center. What doctors would staff it, what nurses would staff it, how our team would manage COVID, how we would manage a walk-in care, who we would pull to cover the hospital versus covering our walk-in care. And normally I try to be very collaborative, working with doctors, nurses, administrators. And for that period of time, we couldn't be too collaborative. We had to be very authoritarian as far as what we were doing, where, when, why. And that was challenging. I think we made the right decision on most things, most decisions. But that's not typically my leadership style. It's usually very collaborative. But certain times call for different styles, and we had to take a different approach during early 2020. as a lifelong Roman Catholic and a very active, Catholic Christian, just to be able to meet Jesus Christ, who we follow and we believe, and really to make sure that that we're all doing what He wants of us. That's where my faith is grounded and my family is grounded. So I think if I think back, there's so many people you might want to meet, past or present or future, but I mean, that to me, that's the obvious choice based on where my family and my faith are grounded.